Hello friends, good afternoon. Now today we are going to discuss about the osteology of mandible. So mandible is a bone which is forming the lower jaw. So mandible, it is development of the mandible. If you just go through the development once. So it is developed in the 6th week of intrauterine life, just after the clavicle. Then it is mostly in membrane. Intrauterine life is mostly in membrane from the fibrous envelope of Meckel's cartilage of the first branchial arch. The cartilage cells being absorbed. So this is about the development of the mandible. And now coming to the parts of mandible. So the mandible parts are, we can identify the body of mandible. Entire this part is called as body. And laterally we can identify the plate. This is called as the ramus of mandible. And it is having two processes which are projecting upwards. From the lateral view you can identify clearly two processes. Anterior process is called as coronoid process. Posterior part is called as condylar process. Coronoid and the condylar process. And between the two processes you can identify a notch called as mandibular notch. Mandibular notch. These are the parts of mandible. Then coming to the body of mandible, this body, it is having external surface and then it is having internal surface. So enter the surface is internal surface and this is external surface. And it is having two borders. Superior border, it is also called as alveolar border, where we can identify the sockets for the teeth. And here you can see the inferior border. Superior, inferior borders, external and internal surface. Then coming to the external surface of body of mandible. So external surface, exactly at the midline, we can identify the symphysis menti, where the right and left halves are going to fuse at the midline, called as symphysis menti. Below this, we can identify a triangular shaped tubercle, called as mental protuberance. Mental protuberance. This is called as, here you can identify, you can feel that tuberance, called as mental protuberance. So on either side of this mental protuberance, you can identify the depression called as incisive fossa. And then if we just slightly turn laterally, we can identify a line here. So this line is called as oblique line. So above the oblique line, there are three muscles from posterior to anterior which are attaching to this mandible from posterior to anterior. Most posteriorly, we can identify the buccinator muscle exactly below this molar teeth, first and second molar teeth. Even it extends up to the third molar teeth as well. Then anterior to this one, we can identify it is giving attachment to depressor anguli oris. Then below to the foramen, we can identify the depressor labii inferioris. Now these are the muscles which are attaching to the mandible external surface. So oblique line, above the oblique line, three muscles remember. Posteriorly buccinator, anterior to the buccinator depressor anguli oris, and most anteriorly depressor labii inferioris. Then we can identify a foramen on the external surface of the body of mandible. This foramen is called as mental foramen, which passes mental vessels and the nerves. Then below this oblique line, which is giving attachment to a muscle called as platysma muscle. Okay, so these are the attachments of the external surface of body of mandible. Okay, then coming to the internal surface of body of mandible. What are the other features? What are the other structures we can identify at the internal surface of body of mandible? At the internal surface, you can identify some tubercles. So these tubercles are called as, exactly at the midline, you can identify the tubercles called as genial tubercles. Superior genial tubercle and the inferior genial tubercle. So superior genial tubercle, which gives attachment to genioglossus muscle. Inferior genial tubercle, which gives attachment to geniohyoid muscle fibers. As you have seen the oblique line at the external surface, at the internal surface also we can identify a line which is extending called as mylohyoid line. So this mylohyoid line, which is giving attachment to origin to mylohyoid muscle. Then at the inferior border, we can identify on either side of the mental protuberance, you can identify some depression. This depression is called as digastric fossa, which gives attachment to anterior belly of digastric muscle. This is about the body of mandible. Then coming to the other features, what are the other features we can identify at the internal surface is, above this mylohyoid line we can identify sublingual salivary gland is present. Below the mylohyoid line we can identify submandibular salivary gland is located. Submandibular salivary gland below the mylohyoid line. Above the mylohyoid line, sublingual salivary gland is present at the internal surface of the internal surface of the body of mandible. Then coming to the plate called as ramus of mandible. So this is the ramus of mandible. This ramus, it is having anterior border, posterior border, superior, we can identify mandibular notch, and it is having two surfaces, lateral surface and the medial surface. So this lateral surface, it is giving insertion to the masseter muscle except at the posterior superior part. So at the posterior superior part, it is occupied by parotid gland. So anterior to the parotid gland, we can identify the masseter muscle, which is getting inserted to the lateral surface of ramus of mandible. And then coming to the medial surface of ramus of mandible. So what are the other features we can identify at the medial surface of ramus of mandible? So the medial surface of ramus of mandible, you can identify a foramen here. Yes. So this foramen is called as mandibular foramen, which is passing inferior alveolar vessels and nerves. Let me show you clearly this mandibular foramen. Yes, you can identify clearly this mandibular foramen. Okay, so this is the mandibular foramen, which is passing inferior alveolar vessels and nerves. Then we can identify a bony projection on anterior to this mandibular foramen called as lingula. So lingula, which is giving attachment to spinomandibular ligament. Here you can see that lingula. This lingula is giving attachment to spinomandibular ligament, which is extending from spine of the sphenoid to the lingula of mandible. Then below to this mandibular foramen, you can identify a groove. This groove is called as, is called as mylohyoid groove. This groove is lodging mylohyoid vessels and the mylohyoid nerves, which are passing in the groove. Then this mylohyoid vessels, these are the branches of inferior alveolar artery and inferior alveolar nerve. Then coming to the two process. Anteriorly we can identify coronoid process, and posteriorly we can identify the condylar process. So this coronoid process, which is giving, it is having borders, anterior border, posterior border, then lateral surface and the medial surface. So the anterior border, posterior border and medial surface, so these are all occupied by the temporalis tendon. Whereas the posteriorly we can identify the mandibular notch. So this notch is crossed by masseteric vessels and nerves. So the masseteric vessel, which is a branch of the maxillary artery, even inferior alveolar artery is also a branch of the maxillary artery. From which part of maxillary artery we will see later in the gross anatomy classes. Then coming to the condylar process, posteriorly we can identify the condylar process. This condylar process, which is having a depression anteriorly called as pterygoid fovea. This pterygoid fovea, which is giving insertion to the lateral pterygoid muscle. And then we have forgotten to discuss about the medial pterygoid muscle insertion. So medial pterygoid muscle insertion, medial pterygoid which is extending down and reaching to the medial surface of ramus of mandible. Behind the groove for mylohyoid groove, and it is getting inserted to the medial surface of ramus of mandible, below this mandibular foramen and behind the mylohyoid groove. And here we have seen the lateral pterygoid muscle insertion, which is to the pterygoid fovea. So, the maxillary artery, it is related to the maxillary artery. So this condylar process, medially, it is related to the maxillary artery. So between the lateral pterygoid muscles and the condylar process of mandible, you can identify the maxillary artery which is running anteriorly and gives the branches of it. So that is about the osteology of mandible. So coming to the ligaments attachments, so main ligaments which are attaching to the mandible. Remember, so between the ramus of mandible and the body, you can identify an angle called as gonion, or the angle of mandible, which is giving attachment to stylomandibular ligament. And here the lingula, which is giving attachment to spinomandibular ligament. Temporomandibular ligament, which is attaching to the lateral surface. Lateral surface, here you can see the lateral surface and the posterior surface of the condylar process of mandible, which is giving attachment to temporomandibular ligament. These are the ligaments which are related to this mandible. And the vessels are inferior alveolar vessel, mylohyoid vessel, and also the lingual nerve, which is present related to the mylohyoid groove. So that is about the structures related to it. Then coming to the inferior alveolar nerve, which is passing through the mandibular foramen. So at the first molar teeth, we can identify it is going to divide into two branches, mental vessels and the incisive vessels. So with the incisive vessels, they supplies to the gums and teeth. So whereas the mental vessels and nerves, which are passing outside through the mental foramina and supplies to the muscles of the outside of the mandible, which are attaching to the external surface of the body of the mandible. So that is about the osteology of the mandible. Thank you.